Here we are again with another great session with Dr. Kamboh of Lansdowne Dental Associates. And today we're going to talk about emergency dentistry. So we were just discussing, we're both soccer coaches. We know that going into sports seasons, dental accidents can happen, both for kids and adults. Sometimes teeth get cracked, sometimes they get knocked out. So in that case, what are the recommended first steps or the immediate steps someone should do in one of those sort of dental emergency scenarios?
Great question, Rob. First thing I would recommend is getting a mouth guard. Some protective mouth guard to help if your children are playing sports, contact sports. That is the first line of defense. Not everyone wears it. I can't say that my own children are very compliant, despite me being a dental professional. I can't say that they actually listen. I could go into a whole segment on that. So we're gonna start there, but I'll answer your question. We'll start from a very basic chip to a tooth that happens to be in the grass. I get these calls a lot, Rob, and parents do get scared when something happens, and the first question is like, when do I have to get treated? Like something got chipped. Is this gonna mess their mouth up forever? And does it even need to be fixed at all? I get a lot of questions, and one of the first things I see is something to look at, and this is kind of how a parent can do a quick assessment. I preface all of this by saying, despite what happens, always follow up with a dental professional, regardless. We see a lot of emergency patients, and we have emergency appointments, so always happy to help. But if you're doing an assessment, say the child gets hit, bumped, and you notice that there's a chip in the tooth, the first thing to take a look at to see if there is mobility in the tooth itself. Another thing to take a look at is to see if when they bite down, the tooth is in the same position as it was prior to the contact. If the tooth is in the same position prior to contact and there is a chip in it, the next thing to look at would be, how deep is the chip? How large is the chip? If you're able to see if it's bleeding from inside of the tooth, or if there's pink inside of the tooth, there needs to be treatment pretty quickly. If there's a chip and you look at it and there is no bleeding inside, you can't notice anything like that, there's a little bleeding around the gums, the tooth is in the same spot, there's a good chance everything is going to be okay. If there is contact and the tooth is in a different position than it was beforehand, seeing a dental professional quickly would be a good idea. What happens when the tooth is laying on the court or the dirt or the pitch, whatever it may be? If a tooth is completely avulsed, knocked out, people don't realize it, but the best thing to do is to replace it right back into the socket. Okay? What I recommend first would be cleaning it off with the saliva, at least getting it off. If there's any debris that's noticed on the tooth, clean that off with saliva and take the tooth and slide it right back into the socket. The periodontal ligament fibers are still alive, and if it happens within a short period of time, they will be able to reattach. Still follow up with a dental professional, because there's a very good chance the tooth will need additional treatment, but it can be saved if it is placed back in pretty quickly. Milk is also another medium that can be used for storage if people don't feel comfortable getting it back in, but putting it in saliva, putting it back in the socket, two easy things to do if there happens to be that emergency. But always following up with the dental professional is the best thing after something like that.
Great. Well, I'm sure we'll hope that never happens, but this is obviously very insightful for information for both individuals and parents, especially as we go into sports season. So very insightful for emergency dentistry tips, and thanks for your time, Dr. Kamboh.
Thanks, Rob. Thanks for having me.
All right. Take care.